The nurse evaluates a patient's status post-right hip replacement and observes a moderate amount of serous drainage on the dressing 1 day after the surgery. Which of the following is the best action? A. Leave the dressing alone to let the wound heal. B. Notify the doctor about possible infection. C. Change the dressing and clean the site with normal saline. D. Replace the dressing and document. E. Remove the dressing and leave the wound open to air. The answer is D. Replace the dressing and document. 24 hours after surgery, surgical wounds are expected to drain small to moderate amounts of serous or serous drainage. The physician does not need to be notified because this observation is expected and not emergent. However, the doctor would be notified if drainage exceeds these expectations. The soiled dressing should be removed and replaced with a new dressing, and the wound site would not be irrigated unless infected. There are no signs of infection noted. The wound should not be open to air due to the risk of infection. The nurse should always document wound appearance and dressing changes. The nurse prepares discharge information for a 70-year-old woman recently diagnosed with osteoporosis. Which of the following information is most essential for the nurse to share with the patient? A. A recommendation for a doctor that specializes in bone pain. B. An information sheet for acetaminophen use. C. A pamphlet about physical activity and daily exercise for people with osteoporosis. D. A flyer for a soccer program. E. A brochure about opiate medication use. The answer is C. A pamphlet about physical activity and daily exercise for people with osteoporosis. Osteoporosis is common among elderly women. Patients require important education on how to live with the disease. Lifestyle changes such as diet and exercise should be promoted by the patient during discharge, and should be specific to the patient's condition. Of the available options, the most accurate and essential information for the nurse to share should concern physical activity and exercise, as osteoporosis affects bone density and body strength. A recommendation for a doctor that specializes in bone pain may be beneficial, but is not a responsibility of the nurse. Education is the priority. Patients with osteoporosis that are being discharged usually take ibuprofen to manage pain, not opioids or acetaminophen. A soccer program may not be appropriate for a 70-year-old woman with osteoporosis. A flyer for an adult walking group might be better. All of the following are common findings in osteoarthritis except A. Stiffness and pain in affected joints. B. Bony protuberances of affected joints. C. Symmetrical joint involvement. D. Asymmetrical joint involvement. The answer is C. Symmetrical joint involvement. Osteoarthritis generally presents as asymmetrical joint stiffness and pain, often with bony protuberances, osteophytes, that are either palpable or visible on imaging. Symmetrical joint involvement is more typical in rheumatoid arthritis. Joints will present with signs of inflammation, redness, heat, pain, and swelling, due to the inflammatory nature of this condition. A positive anterior drawer test of the knee would be indicative of injury to which of the following structures? A. Lateral collateral ligament. B. Posterior cruciate ligament. C. Medial collateral ligament. D. Anterior cruciate ligament. The answer is D. Anterior cruciate ligament. The anterior drawer test of the knee checks for injury to or instability of the anterior cruciate ligament. During this test, the patient lies supine position with knees bent to 90 degrees. The practitioner sits on the both feet of the subject and places both hands around the upper tibia of the patient's symptomatic leg, then pulls anteriorly on the proximal tibia. A positive finding would be excessive anterior translocation or a softened feel, indicating a sprain or tear of the anterior cruciate ligament. Lambert-Eaton syndrome is associated with what malignancy? A. Gastric carcinoma. B. Colon cancer. C. Small cell lung cancer. D. Melanoma. The answer is C. Small cell lung cancer. Approximately 60% of individuals with Lambert-Eaton syndrome have small cell lung cancer. The onset of Lambert-Eaton symptoms often precedes the detection of the cancer and should be followed up with radiographic imaging of the chest. A postmenopausal female client presents to the client after being newly diagnosed with osteoporosis. The client is here to discuss with the nurse what type of lifestyle modifications she will need to treat the disease. Which of the following should the nurse include when educating the client? A. Start a low carbohydrate high protein diet. B. Quit smoking. C. Lose 10 pounds. D. Drink 1 glass of wine with dinner. E. Engage in low impact exercises. The answer is B. Quit smoking. Smoking and alcohol ingestion are risk factors for developing osteopenia or osteoporosis. These activities should be discontinued to help prevent against bone loss. Diet and exercise are important factors, but losing 10 pounds or low impact exercise will not increase bone mass. The nurse cares for a 16-year-old patient in the emergency department. He has returned to the hospital after having a fiberglass cast applied to his right ulna from a fracture the day before. Which of the following manifestations in the patient should most concern the nurse? A. Warm fingers and palm in the right hand. B. Capillary refill of 3 seconds in the right fingertips. C. Itching under the cast. D. Severe pain in the right arm. E. Pain in the right shoulder. The answer is D. Severe pain in the right arm. The nurse should be aware of potential complications of cast placement, such as compartment syndrome, which can cause nervous, vascular, and muscle damage. Signs and symptoms include tingling distal to the cast placement, severe pain in the casted region, swelling in the cast and distal to the casted region, pallor in the affected region, and muscle weakness. These signs and symptoms would indicate immediate cast removal to prevent further damage to the tissue. Itching under the cast is common and expected, and pain in supporting shoulder of the arm can occur due to the increased weight and positioning of the cast. 3 seconds for capillary refill is within normal limits. Extended time for capillary refill in the distal region would be concerning. Warmth in the hand and fingers distal for the casted region would indicate normal circulation as well, but congestion and swelling in the extremity would be worrisome. Which of the following is described as a malformation resulting in narrowing or absence of a portion of the intestine? A. Malrotation. B. Intestinal atresia. C. Volvulus. D. Hirschsprung's disease. The answer is B. Intestinal atresia. Intestinal atresia is a malformation resulting in narrowing or absence of a portion of the intestine. Duodenal atresia is the most common type, followed by ileoatresia. Hirschsprung's disease is an issue of innervation in the large intestine that can result in narrowing due to contraction, but there is no structural malformation in the bowel itself. Malrotation and volvulus are often seen together when a part of the intestine does not anchor or turn correctly during formation, malrotation, and then becomes twisted around itself, volvulus, resulting in constriction and loss of function. What is the triad of symptoms often seen with intussusception? A. Bloody vomit, black stool, and low back pain. B. Colicky abdominal pain, bilious vomit, and red currant jelly stool. C. Constipation, projectile vomiting, jaundice. D. Coffee ground emesis, bloating, and diarrhea. The answer is B. Colicky abdominal pain, bilious vomit, and red currant jelly stool. Intussusception occurs when part of the intestine folds into another section of intestine, much like a telescope. This results in sharp, crampy, or colicky abdominal pain, vomit of bile, and bloody red currant jelly stool. Black stool and coffee ground emesis are both symptoms of upper gastrointestinal bleeding, stomach, generally, while projectile vomiting may be associated with pyloric stenosis. What is the most common location for diverticulitis? A. Ascending colon. B. Transverse colon. C. Splenic flexure. D. Sigmoid colon. The answer is D. Sigmoid colon. The most common location for diverticulitis is the sigmoid colon. This area generally has increased pressure as compared to the rest of the large intestine and is especially vulnerable to weakness in the muscle layers of the colon wall.